So we can start 57th page, Govind pareekh. So different type of marma. Okay. So based on the Vyabat, Sadhyo Pranahara, Kalandara Pranahara, Vaikalyakara, Vishalyagna, Rujagara marma. So 5 types of marma based on the Vyabat. Okay, Sadhyo Pranahara means in this marma, if you have got any trauma, immediately patient will die within 7 days. Okay, so within 7 days patient will die, so that marma is called as Sadhyo Pranahara. Kalandara Pranahara means the marma which any trauma is happened to this marma, the patient will die within 15 days or within 1 month. That is Kalandara Pranahara. Vaikalyagara marma means if any trauma is happening to this marma, it leads to Vaikalya, deformities will be happening, deformities or disability. Vishalyagna means these marma, if any foreign bodies are entering, so we cannot remove it. Okay, so we cannot remove it because if we remove the shalya, what happens? It leads to the death of the patient. So such type of marma is called as Vishalyagna. And the next one is Rujagara. If any trauma is happening to this marma, then it leads to the severe pain in this marma. So this is called as Rujagara. Okay, so based on the Vyabat, 5 types are there: Sadhyo Pranahara, Kalandara Pranahara, Vaikalyagara, Vishalyagna, Rujagara. So which are the Mahabhutas are predominant? Sadhyo Pranahara, it is a Agni Guna is more predominant. So total number of Sadhyo Pranahara marmas are 19 in number. In Kalandara Pranahara, Agni and Saumya Guna is predominant. See, so total number of Kalandara Pranahara is 33 in number. Vaikalyagara marma is Saumya Guna, so total 44 Vaikalyagara marmas are there. Vishalyagna, so here Vayu Mahabhuta is predominant, so 3 marmas are comes under the Vishalyagna. Vishalyagna marmas are Ukshebana, Uksheba and Stabani. Okay, Uksheba and Stabani, these are the Vishalyagna marma. So Uksheba, 2 Uksheba marmas are there, Stabani only 1 in number. So like that 3 Vishalyagna marma, and which is predominant with the Vayu Mahabhuta. And Rujagara marma, so here Agni and Vayu Mahabhuta is predominant, so 8 marmas are there, so total 107 marmas are there. Next one is based on the anatomy. According to Sushruta, 5 types are there. Okay, based on the Adhisthana or anatomy wise, according to Sushruta, it is 5 types are there: Mamsa marma, Sira marma, Snayu marma, Asti marma, Sandhi marma. But according to Vagbhata, 6 types are there. Okay, additionally he has mentioned Dhamani marma. Okay, so based on the Adhisthana, 5 types according to Sushruta, 6 types according to Vagbhata. Mamsa, Sira, Snayu, Asti, Sandhi, this is based on Sushruta. Additionally, one more thing which is added by Vagbhata is Dhamani marma. So Mamsa marma according to Sushruta 11, according to Vagbhata 10 in number. Okay, according to Vagbhata 10. Sira marma according to Sushruta 41, according to Vagbhata 37. Snayu marma according to Sushruta 27, according to Vagbhata 23. Asti marma according to Sushruta 8, according to Vagbhata also 8. Okay, Asti marma according to Sushruta and Vagbhata 8. Sandhi marma according to Sushruta 20, according to Vagbhata also 20. Then additionally which is told by Vagbhata, that is Dhamani marma, that is 9 in number. Okay, so these are the number of marmas based on the Adhisthana. Then based on the Anga, Shakhagada marma, Madhya Sharira and Griva ke upar. Okay, so Shakhagada marmas are total 44 in number. Madhya Sharira, which means Koshta. Okay, Koshta and Uras. Okay, Madhya Sharira means Koshta and Uras. Prishtavamsha. Okay, Madhya Sharira means Koshta, Uras, Prishtavamsha. These 3 togetherly Madhya Sharira, that is 26. Griva ke upar, head and neck area 37. So total 107. So these are the different type of classification of marma based on the Vyabat, based on the Adhisthana, based on the Anga. Okay, the next one is marma parimana. Okay, so 1 angula pramana marmas are Urvi, Kurchashira, Vitapa, Kaksha, Pashva, Stanamula. These are all 1 angula length is there. 2 angula marmas are Manibandha and Gulfa marma. Then 3 angula marmas are Janu, Kurpara marma. Then Hatilike Gartike Saman, which means Panidala. Okay, Panidala, like inside the palm, which means 4 angula will be coming. Okay, Panitala or 4 angula. So that is Hridaya, Basti, Kucha, Guda, Nabhi, Shrinkataka, Seemanda, Neela, Manya, Matrika. So these marmas are having 4 angula pramana or Panitala size. Then remaining marmas are half angula pramana. So these are the parimana of the each marma. Then dosha pradhanya. This is important. Okay, so Murcha, which are the doshas are predominant, Pitta and Tamadosha. Tandra, which is caused due to Vada, Kapha, Tamadosha. Brahma, which is caused due to vitiation of Vada, Pitta, Raja. Nidra, which is caused due to Kapha and Tamodosha. So this dosha pradhanya of Murcha, Tandra, Brahma, Nidra, this is very, very important. Next one is Vanaspati. Phaler Vanaspati. This definition is very, very important. Phaler Vanaspati means the tree which is having fruit only. Okay, that is called Vanaspati. Phaler Vanaspati. Vanaspatya means Pushper Vanaspatya Phalerebi. First of all, flowers will be there, then followed by fruits will be occurring. So such type of trees and plants are called as Vanaspatya. Okay, so definition of Vanaspati, Vanaspatya, very important. Next one is Moolini Dravyas. Okay, Moolini Dravya, the total 16 are there. So in that 16 Moolini Dravya, the 3 will be used for the Vamana Karma, 11 are used for the Virejana Karma, for Shiro Virejana, 2 Moolini Dravyas are using. Phalini Dravyas are totally 19 are there. So in that Vamana Asthabana, for that 8 Phalas we are using. For Shiro Virejana 1 and for Virejana 10. So Moolini Dravya total 16 are there. Vamana Dravya 3 in number. Vacha, Bimbi, Shana, Pushpi. So these are the 3 moolas which is used for the Vamana Karma. Virejana Dravya, that is 11. Hastidandi, Shyama Trivrit, Adoguda, Saptala, Pratyak, Shreni, Gava, Kshiri, Vishanika, Ajaganda, Dravandi, Kshirini. So these are the 11 Virejana Dravya which is comes under the Moolini. Then Shiro Virejana Dravya, Shveda, Shirisha, Jodishmadi. Okay, so in this Shiro Virejana Dravya, which is comes under the Moolini Dravya, is very, very important. Okay, most of the time they used to ask related with the Shiro Virejana Dravya. Then Phalini Dravya total 19 are there. For Vamana Asthabana purpose 8 are we are using. Madanaphala, Damargava, Ikshvagu, Jimodaga, Kritavedana, Kudaja, Trapusa, Hastiparni. So these are the 8 Dravyas which is used for both Vamana and Asthabana Karma, and we are using the Phala of this drugs. Next one is Virejana Dravya, that is total 10 in number. Shankini, Vidanga, Klitaga Dravya, Klitaga Dvaya, Udagirya, Prakirya, Abhaya, Kotara, Pushpi, Kampillaka, Aragvada. So these Phalas we are used for the Virejana Karma, and only one Shiro Virejana Dravya which is used the Phala, that is Apamarga. Okay, so this Shiro Virejana Dravyas comes under the Moolini and Phalini is very, very important. Next they have told about the Surya Varta condition. The shlokas they have mentioned. Shirena Shanti Labhade Kadachit Ushnena Jandu Sukhamapniyat Lakshana. So in Surya Varta you can get one Lakshana, means with Shida Upajara also sometimes the headache will become reduces, and sometimes with the Ushna Upajara also headache reduces. So these 2 symptoms you can see in the Surya Varta. Okay, sometimes you can get the relief of the symptoms with the help of Shida Upajara, and sometimes the symptoms will get reduces with the help of the Ushna Upajara. So both you can see in the Surya Varta. Then another one quotation you can see, Sarvatmakam Kashtataram Vigaram Lakshana. So it is one of the most difficult disorder to treat, that is Surya Varta. Vyadhi Vadandi Udagada Mrityu Kalpa Bishak Sahasre Rabi Durnivaram Lakshana. So this quotation it comes under the Shankhaga. Okay, Shankhaga is much more dreadful disorder. If Shankhaga is happen, within 3 days patient will die. So that much severe difficult disorder is Shankhaga. Okay, so these quotations are comes under these disorders. So this is very important. Sometimes they will tell this line and they will tell you to identify which condition. Next, the 58th page. So in that Charaga Anusara Prakriti Bheda, 6 Prakritis are there. Jadi, Kula, Desha, Kala, Vaya, Pratyatma Niyada. Pratyatma Niyada means habitat. Okay, where you are living, so that that surroundings is called as Pratyatma Niyada, habitat. Okay, so these are the 6 types of Prakriti. Next one is 3 types of Vikriti. Lakshana Nimitta, Lakshya Nimitta, Nimittanurupa. Okay, Lakshana Nimitta means Purva Janmakrita Karma Anusara Vikriti Hona Tada Nakhombar Kamala Pushpa Agriti Ka Banna. So Lakshana Nimitta means here in Purva Janma you will be doing some wrongful activity. So because of that you will be getting some disorder. So because of that from the by birth itself or maybe during the childhood itself you will be getting the disorders. So that's all comes under the Lakshana Nimitta. Without any reason, without eating any Nidana Sevana, you are getting the disorder. Okay, so that's all parts of the Purva Janmakrita. So that comes under the Lakshana Nimitta. Lakshya Nimitta means Karana Prapti Vikriti Yatha Laghu Ruksha Shida Nidana se Vayuka Kubidahona. So Lakshya Nimitta means here you are doing proper Nidana Sevana and because of that you are getting the Roga, then that comes under the Lakshya Nimitta. Next one is Nimittanurupa. Nimitta na ho magar fir bhi nimitta ka karya kare yada ruksha lakhu sheeda se vayu ki shanti hona. So without any reason also there will be reduction of the symptoms you are getting. Okay, like usage of the ruksha lakhu sheeda because these are all will increases the vayu, but what happen? It is reduces the vayu also. Okay, so that comes under the Nimittanurupa. Okay. So these are all comes under the Indriya Sthana. Okay, in Indriya Sthana these are all they have explained. Next, Prakrita Varna, that is also explained in the Indriya Sthana. Krishna, Shyama, Shyama Avadada, Avadada. So these are the 4 normal Varnas which used to happen in our body. Krishna, Shyama, Shyama, Avadada, Avadada. If any other colors are coming, so that's all Vikrita Varna. Next, कुछ मुख्य अरिष्ट some अरिष्ट लक्षणास they have mentioned. So you can see बालों में अकस्मात सीमंद बन जाना. So there is a suddenly there is some bare lines will be appearing in the hair. बाल खींचने पर भी वेदना ना होना. If you are pulling the hair but then also you are not getting the pain. Okay, pulling the hair but pain is not getting properly. तैल न लगाने पर भी तैल की प्रतीति होना. Without using the oil also in the hair, but it is very greasy in nature. Okay, you have not used oil for 2-3 days, but then also the hair will be looking like you have applied oil recently. Like that greasy nature will be there. So this type of lakshanas if we are seeing, which means it is indicated within 6 days patient will die. Then Swabhavika Agni ko Neeli ya Kali Dekhna. So the normal fire, it will be looking like a blue color. Okay, or maybe it will be looking like a blackish discoloration. So like that of colors if you see in the fire. Shayya se utne par बार मूर्छित होना. So while getting up, okay, while getting up repeatedly you are getting fainting. Okay, so these are all indicating within 7 days patient will die. Then Anuloma Pradiloma Rogon ka mil jana. So like both the doshas are moving upward direction, downward direction. These are all getting meeting together and you are getting disorder. So that type of people, they will survive only till 15 days. Then Gomaya Churna ka Shirase Girna. So like Gomaya Churna has fall into the hair. Okay, in the head area. Then Mutra Purisha Virya ka jal mein dub jana. So Mutra Purisha Virya, these are all getting sinking into the water. So this type of lakshanas if you are seeing, that is indicating within 1 month patient will die. Lalada va vasti par kutila rekhaon ka nirman. So in the lalada, in the vasti, which means in the forehead area, in the vasti pradesh, you can see there will be new lines are forming. So these are all indicating 1 month only patient will be living. Next, Bhakti va Smarana Shakti ka akasmat nash ho jana. So suddenly you are losing the memory related with the Bhakti. Memories are losing and Bhakti, these are all you are not chanting properly. Okay, you are not doing the prayer. So you are forgetting the prayers. Mastak par dhamaniyon ka sundara jal ban jana. So in the head area you can see there will be new lines will be forming, new dhamanis will be forming. Sharir par chandan ka leb karne par pehle chati ke leb ka suk jana. if you apply the chandana leva, okay, if you apply chandana leva all over the body, but in the chest area immediately the dryness will be occurring. Okay, if you apply sandalwood paste like chandana leva for all over the body, okay, so dryness first of all you will be getting in the chest region, so that is all indicating that within 6 months patient will die. Okay, so loss of memory, loss of prayer, and there is a new veins will be forming in the head area, and if you apply the chandana leva all over the body and in the chest area, very easily dryness of the leva is happening. These are all indicating 6 months only the patient will living. Then purushika pushpidu ho jana. Then Arundhati Nakshatra ko na dekh pana. So like the patient is not seeing Arundhati Nakshatra. Okay, so this type of lakshanas are there, which means within 1 year the patient will die. So these are the some of the important Arishta lakshanas. So next one is Sa Artha Indriya Guna. Okay, it is also known as Vaisheshika Guna. Sa Artha Indriya Guna or Vaisheshika Guna. So that is 5 in number, that is Shabda Sparsha Rupa Rasa Gandha. Okay, Shabda Sparsha Rupa Rasa Gandha is Indriya Guna. Next one is Gurvadi Guna or Sharira Guna. Okay, so that is 20 in number, that is Guru, Manda, Shida, Snigdha, Slekshna, Sandra, Mridu, Sthira, Sukshma, Vishada, Guru, Manda, Shida, Snigdha, Slekshna, Sandra, Mridu, Sthira, Sukshma, Vishada, Lekhu, Tikshna, Ushna, opposite of all these things. Okay, so Lekhu, Tikshna, Ushna, Ruksha, Khara, Drava, Ruksha, Khara, Drava, Kadina, Sara, Stula, Kadina, Sara, Stula, Pichila. Kadina, Sara, Stula, Pichila. So these are the Gurvadi Guna or Sharira Guna, 20 in number. Next one is Adhyatma Guna, Atma Guna. Okay, 6 are there. Icha, Dvesha, Sukha, Dukkha, Prayatna, Buddhi. Icha, Dvesha, Sukha, Dukkha, Prayatna, Buddhi. These are the Atma Guna or Adhyatma Guna. Next one is Paradi Guna or Samanya Guna, 10 in number. Para, Apara, Yukti, Sankhya, Samyoga, Vibhaga, Pridakatva, Parimana, Sanskara, Abhyasa. Okay, so these are the Paradi Guna, 10 in number. So total 41 gunas are mentioned in Ayurveda. Next one is Trivida Roga Marga, they have mentioned. Okay, Trivida Roga Marga, that is divided into 2, Bahya Roga Marga, Madhyama Roga Marga, Abhyantara Roga Marga. Bahya Roga Marga, it is also known as Shakhagata Rogas. Okay, the roga which is affecting in the Shaga Pradesha, that is called Bahya Roga Marga, that is 15 in number. So which are the 15 Bahya Roga Margas? Galaganda, Pidaga, Alaji, Charma, Keela, Arbuda, Adimamsa, Apaji, Mashaga, Kushta, Vyanga, Behir Marga, Shruda, Visarpa, Shofa, Gulma, Ashras, Vidradi. So total 15 are there. Okay, Bahya Roga Marga or Shakhagada Rogas are 15 in number. Madhyama Roga Marga, that is 12 are there. Pakshaghada, Pakshagraha, Apadanaga, Ardhida, Shosha, Raja, Yakshma, Astishula, Sandishula, Guda, Brahmsha, Shiro, Hridaya, Vastigada, Vyadi. These are all 12 conditions are there. These are all called as Madhyama Roga Marga. Next, the last one is Abhyantara Roga Marga or otherwise known as Koshtagada Rogas. Okay, so in Koshta, which are the conditions are coming? 16 conditions are there. Adisara, Jwara, Hikka, Shwasa, Kasa, Chardi, Alasaga, Visujiga, Anaha, Udaramaya, Pliha, Andarmargashrada Visarpa, Shofa, Gulma, Ashras, Vidradi. So these are the 16 Abhyantara Roga Marga or Koshta Gada Roga. Okay, Bahya Roga Marga, it is also known as Shakha Gada Roga. Okay, so here Shakagada Roga Sangya 14 they have mentioned, but it is actually 15. Okay, so 15 Shakagada Roga, Madhyama Rogas are 12, and Koshtagada Roga, or otherwise known as Abhyantara Rogas, are 16 in number. Next thing they have mentioned about the Vimanasthana. From the Vimanasthana they have mentioned about the Vada Margas. Okay, so these points are comes under the Vada Marga. So Karana Sankhya, that is totally 13 in number. Okay, Karana total 13 are there. Bahya Karana 10, Andaha Karana 3 are there. Next one is Jnana Upaya. Okay, in 3 ways we can get the knowledge. Okay, Jnana Upaya, that is 3 are there. So that is Adhyayana, Adhyabana, Tadvidya Sambhasha. Adhyayana, Adhyabana, Tadvidya Sambhasha. So these are the Jnana Upaya. Okay, how we are getting the knowledge? Adhyayana, Adhyabana, Tadvidya Sambhasha, by studying. Okay, Adhyayana, Adhyabana by teaching. Tadvidya Sambhasha by discussing with others. Okay, so in these three ways we can get the knowledge. Next one is Parishad. Okay, so Parishad 2 types are there. Jnanavadi and Mooda Parishad. Jnanavadi and Mooda Parishad. Then Jalpaga Avaguna 5 in number. Then Ahedu, that is 3 in number. Okay, Ahedu or otherwise known as Hetwa Bhasa. Okay, Ahedu or otherwise known as Hetwa Bhasa, that is 3 in number. That is Prakarana Sama, Prakarana Sama, Samshaya Sama, Samshaya Sama, Varnya Sama, Varnya Sama. These are the 3 Ahedu or Hetwa Bhasa. Okay, Ahedu or Hetwa Bhasa means which we cannot prove. Okay, which we cannot prove, that is 3 types are there. Prakarana Sama, Samshaya Sama, Varnya Sama. Then Sambhasha. Okay, that is of 2 types are there. Sandhaya Sambhasha, Sandhaya Sambhasha, and Vigrahya Sambhasha. Sandhaya Sambhasha and Vigrahya Sambhasha. Sandhaya Sambhasha means friendly discussion. Okay, friendly discussion is Sandhaya Sambhasha. Vigrahya Sambhasha means like a debate. Okay, so that is Vigrahya Sambhasha. Then Jalpaga Gunas are 5 in number. Then Hedu 4 are there. They are Pratyaksha, Anumana, Upamana, Aidihya. Pratyaksha, Anumana, Upamana, Aidihya. These are the 4 types of Hedu. Next one is Vipakshi or Para. Okay, that is of 3 types are there. Pravara, Sama and Pratyavara. Pravara, Sama and Pratyavara. Then Siddhanta, 4 types are there. Sarvatantra Siddhanta, Sarvatantra Siddhanta, Praditantra Siddhanta, Sarvatantra, Praditantra, Adhikarana Siddhanta, Abhyupagama Siddhanta, Abhyupagama Siddhanta, Sarvatantra, Praditantra, Adhikarana, Abhyupagama Siddhanta. Then Chala. Chala 2 types are there. Vak Chala, Vak, V-A-K, Vak Chala, Samanya Chala. Vak chala, samanya chala. Next one is Shabda, that is 4 types are there. Drishtartha, Drishtartha, Adrishtartha, Satya, Anruda. Drishtartha, Adrishtartha, Satya, Anruda. Anrutha, Anruda. Next one is Vakya Shesha or Vakya Dosha. Okay, Vakya Shesha, Vakya Dosha, both are same, that is 5 are there. Nyuna, Nyuna, Adhiga, Anarthaga, Aparthaga, Nyuna, Adhiga, Anarthaga, Aparthaga, Viruddha. Nyuna, Adhiga, Anarthaga, Aparthaga, Viruddha. These are the Vakya Doshas. Then Nigraha Sthana 3 and 15 is also there. 2 numbers you can get in the shloka. 3 types and 15 types. Then Sattva 3. Then next one is Sara. Okay, Sara 8 types are there. Tvaksara, Rektasara, Mamsasara, Meda, Asti, Majja, Shukra, Sattva. Tvaksara, Rektasara, Mamsa, Meda, Asti, Majja, Shukra, Sattva, Sara. These are the 8 type of Sara. Okay, so in that Sattva Sara or Sarva Sara is Sreshta. Okay, Sattva Sara, Sarva Sara is Sreshta. And Kashyapa has telling 9 types of Sara. In that Oja Sara is additionally he has mentioned. Then Samhanana 3 types are there. That is Sama Suvibhaktasti. Sama Suvibhaktasti. Sama Suvibhaktasti. That is first one. Okay, Samhanana means compactness. Compactness of the body. Sama Suvibhaktasti. Sama Suvibhaktasti. Second one is Subadha Sandhi. Subadha Sandhi. Third one is Suvinishta. Sunivishta Mamsa Shonidam. Sunivishta Mamsa Shonidam. Which means proper asthis are there and proper joints are there, and near to the bones and joint proper Mamsa and Shonida is there, then it is called as Samhanana. Based on these 3 things we will be assessing the Samhanana of the body. Okay, Sama Suvibhakta Asti, Subadha Sandhi, Sunivishta Mamsa Shonidam. Okay, so based on that Pravara, Madhyama, Avara, like that Samhanana we will be seeing. Then Satmya. Okay, so that is also Pravara, Madhyama, Avara. These are the 3 type of Sattva. 3 type of Satmya is 3 types based on the Rasa Satmya. Okay, Pravara, Ega, Mishra. 3 type of Satmya is Pravara, Ega, Mishra. Pravara, Ega, Mishra. Sattva is 3 types. That is based on the like how much you can you can withstand the pain. Okay, how much you can withstand the pain based on the Sattva 3 types. Pravara, Madhyama, Avara. Pravara, Madhyama, Avara. Okay, Satmya, Pravara, Ega, Mishra. Next one is Anjali Pramana. Each thing how much quantities are very important. Most of the time Para Ojas, Apara Ojas, Stanya, Artava, these all the things most of the time they used to ask. So Jala Sveda Lasika 10 Anjali, Rasa 9 Anjali, Rekta 8 Anjali, Purisha 7 Anjali, Kapha 6 Anjali, Pitta 5 Anjali, Mutra 4 Anjali, Artava 4 Anjali, Vasa 3 Anjali, Meda 2 Anjali, Stanya 2 Anjali, then Majja 1 Anjali, Mastishka, Shukra, Apara Ojas are half Anjali. Okay, so Apara Ojas very important. Apara Ojas, Stanya, Artava, Shukra also important. Then Kashyapa has mentioned Ojas and Kapha both are same quantity 6 Anjali. Okay, according to Kashyapa, Oja Pramana and Kapha Pramana both are same quantity 6 Anjali. Then Para Ojas is 8 Bindu, Apara Ojas is half Anjali. Very, very important. Then according to Dalhana, Apara Ojas is 1 Anjali. Okay, Apara Ojas is 1 Anjali. According to Vakphata, 1 Prasrada. Okay, Apara Ojas, according to Dalhana, 1 Anjali. According to Vakphata, 1 Prasrada. According to Ashtanga Hridaya, Para Ojas is 6 Bindu. Para Ojas is 6 Bindu. Next one is Shaddadvatmaka Purusha Bhava, total 56 are there. So in that Parthiva Gunas are 18, Apya Gunas are 15, Agneya Gunas are 5, Vayavya Gunas are 11, Antariksha Gunas are 5, Atmaja Gunas are 2. So total 56 bhavas are there. Then Haritakyadi Churna Sevana Uparanta Samsarjana Kala. After the usage of the Haritakyadi Churna, for how many days we have to do the Samsarjana Krama? If it is a Hina Shuddhi 3 days, Madhyama Shuddhi 5 days, Pravara Shuddhi 7 days. Then according to Chakrapani, Taruna Jwara. Okay, Taruna Jwara means first 7 night is called as Taruna Jwara. Okay, the first day onwards till 7 days it is considered as a Taruna Jwara. 7 to 12 days, okay, the Jwara is still continuing, it is persisting for 8th day, 9th day, then it is called as Madhyama Jwara. After 12 days also if Jwara is persisting, then that is called as Jirna Jwara. Okay, so first 7 days Taruna Jwara, 7 to 12 days is Madhyama Jwara. After 12 days it is still persisting, then it is called as Jirna Jwara. Then according to Chakrapani, there is a treatment for the Kushta. Okay, so Vamana Karma that should be done every 15 days. Okay, in Kushta Chikilsa, Vamana Karma should be done during every 15 days. Virejana Karma should be done once in every month. Nasya Karma should be done every 3rd day. Okay, every 3rd day. Rekta Mokshana should be done once in 6 months. Okay, during 6 months you have to do Rekta Mokshana, Nasya every 3rd day, Virejana once in a month, Vamana during 15 days you have to do the Shodhana. This is the Shodhana therapies for the Kushta. Then some quotation they have mentioned that is same for 3 conditions you can see. Naraha Padadi Kashtavat. This is a lection of Murcha. Okay, if a patient is getting Murcha, the patient will fell down. Okay, loss of consciousness will be happening. So the patient will be fell down like a Kashta. Kashta means the dry wood, how it will be fall down. No? Dry wood. Okay. Wood, W-O-O-D, dry wood, how it will be falling down. In the same way, the person is falling down. So that is called as Murcha Lakshana. Naraha Padadi Kashtavat. In sannyas also same lakshana you can see. Kashti Bhudo Mrudopamam Lakshana. Kashti Bhudo. So the patient will be getting loss of consciousness and he will be fall down like a how the dry wood is be falling down in the same way. And along with that additional one more symptom he has told Mrudopamam, like a dead body. Okay, like a dead body, if a patient is falling or after the falling the patient will be looking like a death state. So that is called as sannyasa, that lakshana. Then Bhakna Darvi Viva Nishkriya. So this is also same thing. This is you can see in the Madhyaki Andhya Avastha, which means when the patient is when the person is drinking alcohol. Okay, so while starting time 1 or 2 peg if they are eating first stage, then again if the person is drinking so much alcohol, he will reach into the second stage, then again he will reach into the third stage, then the last stage is the fourth one. Okay, Pradama, Dvidiya, Tridiya, Chaturtha. So these are the 4 stages of the alcoholism. So when the person reach the excessive intake of alcohol, he will reach in the 4th stage. So in the 4th stage, what is happening? The patient will be getting loss of consciousness and he will fall down. Okay, the same how the wood is falling down, in the same way he will be fall down. We have seen, no, like in the films you can see, like after intake of so many alcohol, what happened? He will be speaking and he will fall down, and then suddenly you can see he will be sleeping in that particular area. So that is the 4th stage. Okay, so this lakshana, like the person will be falling down like a dry wood. So that type of lakshana you can see in the 3 conditions: Murcha, Sannyasa, and in the 4th stage of the Madhya. So rest of the things we'll discuss on the next video.